Hi, my name is Giselle, and today I'll be presenting my health education resource on pertussis, also known as whooping cough. I'll be walking through the purpose and target audience of my infographic, as well as how I developed it, including my use of AI, and how I ensured the information was accurate and evidence-based. I'll also discuss the design choices I made and reflect on the strengths, limitations, and ethical considerations of using AI in healthcare education. The goal of my infographic is to educate school-aged children about pertussis, also known as whooping cough. The resource focuses on increasing awareness of key symptoms, how the infection spreads, and strategies to prevent transmission. The aim is to not only improve individual understanding, but to also encourage behaviours that reduce the spread of infection within the wider community, in particular in high-contact environments such as schools. The target audience for this resource is school-aged children, approximately between 10 and 16 years old, within the Illawarra community. This group was selected because they represent a key population involved in the transmission of pertussis, due to close and frequent contact in environments such as classrooms, sporting activities, and social settings. The infection can spread rapidly between individuals. Although children in this age group may not always experience severe illness themselves, they can unknowingly transmit the infection to more vulnerable populations, mainly infants who are at the highest risk of serious complications, including hospitalisation and, in severe cases, death. Evidence from the public health organisations such as World Health Organization and New South Wales Health highlights the importance of reducing transmission within this group as a strategy to protect the wider community. Therefore, this infographic aims to provide clear, accessible health information that empowers young individuals to recognise symptoms early, practice preventative behaviours, and understand the broader impact their actions can have on others. AI-supported research process. Generative AI, specifically ChatGPT, was used in the early stages of this assessment to support brainstorming and content development. AI was used to identify key topics for the infographic, including symptoms, transmission, prevention, and treatment, as well as to generate simplified explanations appropriate for a school-aged audience. For example, AI initially described pertussis as a highly contagious respiratory infection, spread through coughing and close contact. While this provided a useful starting point, it lacked depth, mainly in relation to symptom progression, duration of illness, and potential complications. To ensure accuracy, all AI-generated content was critically evaluated using reputable sources, including New South Wales Health, the Centres for Disease Control and Prevention, and the World Health Organization. These sources confirmed that pertussis typically presents with cold-like symptoms initially, before progressing to severe and prolonged coughing fits, and that transmission occurs via respiratory droplets in close contact environments such as schools. During this process, it became evident that AI outputs were often oversimplified and did not fully emphasize the severity of complications in vulnerable populations such as infants. This reflects a key limitation of AI, being its tendency to provide generalized summaries without highlighting clinically significant risks. Additionally, AI does not independently verify sources, meaning there is a risk of incomplete or outdated information if not critically assessed. Therefore, AI was used as a supportive tool only, with all final content refined, cross-checked, and validated using evidence-based sources to ensure both accuracy and safe health communication. Evidence review and fact-checking. To conduct my literature review, I used a range of reputable evidence-based sources including New South Wales Health, the Centres for Disease Control and Prevention, and World Health Organization. These sources were selected to provide a combination of local, clinical, and global perspectives on pertussis. The initial AI-generated content was used as a starting point and then systematically compared against these sources to verify its accuracy. This involved identifying key statements generated by AI and cross-referencing them with information from each source to ensure consistency. For example, AI described pertussis as a contagious respiratory infection with cold-like early symptoms. This was confirmed across all three sources. However, further review identified additional detail that was not fully captured by AI, mainly regarding the duration and progression of symptoms. The CDC provided more detailed clinical information, including that early symptoms can last 1 to 2 weeks before progressing to severe coughing fits, which may persist for several weeks. It also provided statistical data on complications such as hospitalization rates and risks in infants. The World Health Organization emphasized the global burden of pertussis and highlighted vaccination as the most effective prevention strategy. mainly in reducing infant morbidity and mortality. New South Wales Health provided locally relevant information, including vaccination schedules and public health recommendations within Australia, which helped ensure the resource was contextually appropriate for the Illawarra community. Through this comparison process, discrepancies were identified, mainly in the level of detail and emphasis on complications. As a result, decisions were made to expand on the symptom progression and include stronger messaging around the risks to infants, while still maintaining simple language appropriate for the target audience. This approach ensured that the final infographic was both evidence-based and appropriately tailored, balancing clinical accuracy with accessibility for school-age children. Design and development. For my education resource, I created a one-page infographic focused on pertussis, designed specifically for school-age children. I used Canva to design the infographic, as it allowed me to create a visually engaging and easy-to-follow layout. I structured the information into clear, numbered sections, including what the disease is, how it spreads, signs and symptoms, prevention strategies, treatment options, and when to seek help. This structured layout supports logical flow and makes information easier to process. I intentionally used simple language and short sentences to ensure the content was easy to understand for the younger audiences, while still maintaining accuracy and alignment with evidence-based information. Visual elements such as icons, illustrations, and colour were included to increase engagement and reinforce key messages, as visual learning is very effective for this age group and can improve information retention. The design aligns with key health promotion principles, such as accessibility, relevance, and engagement. For example, the inclusion of "Why should you care" section makes the information more personally meaningful, which is important in encouraging behaviour change. Overall, the infographic meets the intended goals by educating school-age children, increasing awareness of symptoms and transmission, and promoting preventative behaviours such as vaccination, hand hygiene, and staying home when unwell. This is my infographic for whooping cough, pertussis, what you need to know. Feel free to pause the video so you can take a better look at it. Critical review. This project highlighted both the benefits and ethical considerations of using AI in nursing practice. AI was useful in supporting in the research process, specifically in generating initial ideas and helping structure the context of the infographic. It allowed me to quickly identify key topics and simplify complex information for a younger audience. However, this process also emphasized that AI cannot be relied on as a primary source of information, especially in healthcare. AI-generated content is not always fully accurate. It can lack clinical depth and may omit important risks or complications. If used without critical evaluation, this could lead to the spread of misinformation, which has significant implications for patient safety. From an ethical perspective, nurses have a professional responsibility to ensure that all health information provided is accurate, evidence-based, and safe. This aligns with principles of non-maleficence, meaning do no harm, as well as accountability in the professional practice. Using AI without verification would conflict with these responsibilities. This required me to critically evaluate all AI-generated content and cross-check it against reliable sources such as New South Wales Health, the CDC, and World Health Organization before including it in my resource. This process ensured that the final infographic met standards of safe and ethical health communication. One of the key strengths of my infographic is that it's very simple, visually engaging, and tailored to a school-age audience. It presents important health information in a way that is accessible and relevant, which supports effective health promotion and encourages behaviour change. However, a limitation of the resource is that the content has been simplified, meaning it may lack clinical depth and does not account for all individual variations in presentation or severity. Additionally, while the information is evidence-based, it remains generalized and may not replace professional medical advice. Overall, this project reinforced that AI can be a valuable supportive tool in nursing, but it must be used responsibly, with critical thinking and ethical awareness, ensuring accuracy and patient safety must always remain the priority when using emerging technologies in healthcare.